we are going to see the remaining topics of humerus. In the previous two classes, we have already seen about basic anatomy of humerus, which involves the introduction to humerus by definition, importance, and surgical relevance. And also we have seen about the parts of humerus, like there are mainly three parts: proximal end, shaft, and a distal end. And then we have also seen about the proximal end of humerus in detail, involving the parts like neck, head. And in neck we have mainly two types: anatomical neck, another one is surgical neck. And also we have seen about the greater and lesser tubercles. And in the shaft of humerus, we have learned about the structure and also about the key features, surgical note, and all, as an anesthesia technologist. And also we have seen about the distal end, which includes capitulum, trochlea, epicondyles, fossa, etc. And also we have seen about the muscle attachments in the proximal end, mainly like supraspinatus, infraspinatus, teres minor, subscapularis, pectoralis major, pectoralis minor, and teres major, latissimus dorsi, and all. And also we have seen about the attachments in shaft and distal end, especially deltoid muscle, brachialis, brachioradialis, and flexular muscles and extensor muscles. In this session, and also we have seen about the blood supply of humerus. In that we have seen about the main arteries, nutrient artery, and surgical relevance. In this session, we will be continuing with the ossification of humerus. So, especially in blood supply, I forgot to tell that the humerus gets blood from profunda branchi artery, which runs radial nerve with the radial nerve in the radial groove. And also we have circumflex humeral arteries which feed the head. And also we have nutrient arteries which supplies marrow in the shaft. In clinical note, I just want to say that the neck fracture can cut off the blood to the head, risking avascular necrosis, that is bone death. And in OT, the surgeons preserve these vessels during fixation. In ossification, I just want to say that the humerus forms via endochondral ossification. That means the bone is formed from a cartilage. The shaft starts its fetal life in the 8th week, while the head and tubercles and the distal ends get secondary centers after birth, fusing by our 20s. In kids, the growth plates, that are also called as epiphyseal plates, are key. Damage can shunt arm growth. And also OT tip, for pediatric fractures, handle gently to protect the growth plates. X-ray shows ossification centers and guide for surgery. And then now we are going to see about, so we have seen stages of humerus ossification: cartilage model. Hyaline cartilage forms in embryo, then comes to the primary ossification, the bone forms in diaphysis. And secondary ossification, the centers in the head, tubercles, and distal end. Epiphyseal plate closure. The growth plates fuse completely during ossification or during adolescence. This is done in the adolescent period. Next, we are going to see about the clinical relevance of ossification. So it involves in the fracture healing, pediatric surgery, and operation theatre. So fractures are big deal here. So in surgical neck, common in elderly, risk circumflex artery damage. The shaft also risk radial nerve, causing wrist drop. And in distal, it is common in kids, risk growth plates and nerves. In the OT, you assist with ORF or nailing, prepping plates, screws, or C-arm for X-rays. Position the patient to avoid nerve compression. Think of supine with the arm supported anesthesia technologist. You might guide ultrasound for blocks and side determination to the left from the right humerus. Hold the head facing medially and the greater tubercle laterally. At the distal end, the trochlea is medial and capitulum is lateral. You can practice with a model. So, for example, shaft fracture needs nailing. Your preparation, the nail kit, ensure the arm is stable. Next, surgical relevance. So we have already seen about it. So fracture management, operation theatre role. And in summary, I just want to wrap it. The humerus is the upper arm powerhouse linking shoulder to elbow. It's got key parts like head, shaft, and distal end. Muscles like rotator cuff, deltoid, flexor or extensors, and the blood supply, which protects it in surgery. We should protect in surgery. And ossification tries fracture healing, especially in kids. Growth plates in the OT. We will handle tools, patient positions, and ensure same smooth procedures. So that's it, folks. I hope you are ready to rock in OT with your humerus knowledge. If you have any kinds of doubts or you can comment, and let's see another topic. Thank you, a big thanks for watching, and we'll see you in the next lecture. Thank you.